have been keeping you updated on a recall involving baby formula, and just this week, Abbott Nutrition has expanded that recall. I want to bring up these images showing you the formula that we are talking about right now. Bacteria that could be in this formula has already made 4 babies very sick. One of those babies died, and several news outlets are reporting the FDA is currently investigating a potential second death. We understand that there are a lot of parents who have questions about this. We took those questions to a pediatrician with Atrium Health. Here's that conversation. Dr. Trey Williams with Atrium, it's great to have you here. Thank you so much for answering my questions about this expanded recall. We're talking about Similac formula. This is something that is a big concern for many families. Have you treated anybody in the Charlotte area for any concerns or issues related to this recall?
So no, at least to my knowledge, we haven't treated anybody with either infections from the 2 bacteria that are suspect in some of the Similac products that have been recalled, specifically Chronobacter and Salmonella. And so we haven't treated anybody in particular, but we certainly have been seeing a lot of concerned parents who some are even on some of the affected products or other Similac products who just have general questions about either switching, how comfortable they should be keeping their kids on Similac products. And so it's generated a lot of stress, I would say, among parents.
We've heard from those parents, and a lot of them, like we were discussing, depend on this specific formula. So a lot of people are looking for safe alternatives at this time. For those families who are going to be listening to our broadcast, what is your advice?
So I'd say my first piece of advice is please talk to your pediatrician about either substituting formulas, because it can be quite confusing. There's a lot of different products out there. I think most parents have at least seen the formula aisle and the hundreds of different options that are out there, if not done their research online and seen even more that are available. And so I think the first piece of advice I would give would be talking to your child's pediatrician about what would be a good substitute. The second thing I would say is look to see if your cans or other products are the ones affected. And so on the Abbott website, you can actually type in the lot number, and it will tell you if you're giving your child one of the affected products or if you're not. And I would say at this point, all the ones that have been recalled are coming from one facility out of Sturgis. And so other facilities that are making these products thus far have had no investigations, no recalls. So it really is specific to one location. And I think if your product is not part of that recall, it would be safe to continue giving that at this time. But we do understand parents' anxiety about Similac in general when you hear about a recall like this.
You know, it's not just babies who use formula. That's what you think of when you think of a product like Similac. But we've learned through this recall that there are families who heavily rely on this, depend on this, family members with a different medical condition. So walk me through the other groups who depend on formula.
So yeah, you're right. There's lots of other people that rely on formula. Anybody who's feeding tube dependent due to a variety of underlying conditions certainly rely on various different forms of formulas, often not just the infant formulas. I mean, if they're an infant, obviously that would be the case, but older kids, there's special formulas, liquid formulas that are used in tube feedings for those kind of patients. Then you have other patients who have rare conditions. Galactosemia is one. They need special feeds really throughout their entire life. And then you have other kids who have sensitivities to lactose products, to milk products, who need to use these maybe even a little past the 1-year mark, where you typically would end using infant formulas. And so there's lots of different other groups that really rely on these specialized formulas. One I failed to mention was the Similac 60/40, one of the ones that was recalled, is really for kids who have renal impairment. So there's lots of different groups and underlying conditions that are indications for kids to continue using various formulas.
As this investigation continues and we see that recall is expanded, a little more far-reaching, walk me through the symptoms so that way families are aware if they have this on their shelves, if they've had someone consume it, what kind of symptoms should they be on the lookout for?
Just general irritability, which can obviously be due to a lot of different things, but that can be an early sign that something's awry. with your child. Other signs would be lots more vomiting, or spitting up than typical. And then specifically with the Chronobacter and the Salmonella, we worry about diarrhea, specifically bloody diarrhea. And so if you're seeing any of those signs, again, I would encourage you to talk to your pediatrician if you're acutely concerned about your child. Certainly go to an urgent care or an emergency room, but certainly involving your pediatrician early if there's concerns or you're seeing some of those signs is the best way to go.
Dr. Trey Williams with Atrium, thank you so much. Is there anything else that you would like to add?
No, I think we've covered it all. I think the important thing is to really just try and stay calm. There's lots of different options out there, lots of different brands and products and good substitutes for your child. Just make sure if you are switching formulas, you're aware that there is a transition period that takes them a little bit of time to get used to a new formula because there are slight differences. So make sure you give your child a little bit of time if you are switching to a new formula before you decide if they've responded or not.